Psychotic disorders. Definition. Psychotic disorders are a group of serious illnesses that affect the mind. They make it hard for someone to think clearly, make good judgment, respond emotionally, communicate effectively, understand reality, and behave appropriately.
Visualize yourself out with friends. You're at your favorite restaurant waiting to be served. Suddenly, you notice people are watching you. You begin to hear people whisper your name. You know they're about to do something. Your friends don't notice that you're all about to be harmed. You mention what's happening to your friends, and they're confused. You have to make them understand quickly before something bad happens. If you've experienced something like this, it could be psychosis. Even shadows, hearing voices or sounds that other people do not hear. Disorganized thinking that can make it difficult for other people to understand what they're trying to say. Sharing thoughts or beliefs that others who are close to them might find strange or unusual, such as believing that they have special powers, or that they're being watched, followed, or spied on, or that they are receiving messages through the television or internet that they feel are meant just for them. People who hear and see things that others do not may appear to be distracted or take a few moments to respond when asked a question. Sometimes, people experiencing psychosis may have a hard time concentrating, or their thoughts can get mixed up. Every person's experience with psychosis is unique, then violent. Another myth is that psychosis will not get better. Symptoms of psychosis can be managed through support, therapy, and by taking medications. People who have experienced psychosis can go on to lead healthy, productive lives. Recovery from psychosis is achievable through early intervention. Studies have found that the earlier someone gets help with psychosis, the better their outcomes will be.
Applications in medicine. Psychotic disorders include schizophrenia. People with these illnesses have change in behavior and other symptoms. Schizoaffective disorder. People have symptoms of both schizophrenia and mood disorders such as depression or a bipolar disorder. Schizophreniform disorder. This includes symptoms of schizophrenia.
This is a brief video on psychotic disorders. We're going to be talking about psychotic disorders that are listed in the DSM-5 for psychiatry. And this video will specifically help you differentiate between schizophrenia, schizophreniform disorder, brief psychotic disorder. It requires psychoses in the absence of a mood disorder. This is kind of to make sure that the primary disorder is the delusions and the hallucinations. The primary disorder is the schizophrenia and not the mood disorder. So that's essentially schizophrenia with light involvement of mood. Thoughts and behaviors, flight of ideas, activity increase, sleep decrease, and talkativeness or talkative behaviors. Ziprasidone, quetiapine, olanzapine, aripiprazole, and clozapine, where clozapine is the most effective of the second generation antipsychotics and is often
Advantage. Treatment for psychosis and some methods of prevention are antipsychotic drugs. Treatment with a class of drugs known as antipsychotics is the most common therapy for people with a psychotic illness. Antipsychotics are effective at reducing psychosis symptoms in psychiatric disorders such as schizophrenia, but they don't themselves treat or cure underlying psychotic illness.
In general, the first challenge is to make the appropriate diagnosis, to make sure that there's no other medical condition or substance use that might be accounting for the psychotic signs or symptoms. And so we have to take into consideration the presence of things like delusions, which are fixed false beliefs, or hallucinations, like hearing a voice when no one is speaking. But we also have to feel comfortable that those symptoms are present with enough severity, intensity, and frequency to justify a diagnosis of a psychotic disorder. We also will often see that someone has had a deterioration in functioning, either in school or at work or in terms of their social relationships. So all of those things are taken into consideration, and these symptoms need to be present for a certain amount of time before we would consider the diagnosis of a specific illness. Unfortunately, when people begin to experience psychotic symptoms, they often go for a long time before receiving treatment. We call that the duration of untreated psychosis. We believe that the longer it goes undiagnosed and untreated, that the more difficult it is to achieve the outcomes that we like to achieve. And in the data that we've analyzed so far from the RAISE study, we did find that those individuals who had a duration of untreated psychosis longer than 74 weeks were not as likely to benefit from our comprehensive care intervention as those patients who had a shorter duration of untreated psychosis. So we do believe that the timing is important, and trying to
Disadvantage. Depending on the cause, psychosis can come up quickly or slowly. The same is the case in schizophrenia. Also, the symptoms may have a slow onset and begin with the milder psychosis. Some people may experience a rapid transition back to psychosis if they stop taking their medication. The milder initial symptoms of psychosis may include feelings of suspicion, general anxiety, distorted perception, and depression.
Let's demystify what those terms mean. What are psychosis? What are schizophrenia?
Yes. Psychosis can describe a state of having a change in behavior, change in perception, maybe starting to, I think classically, you hear about things like hallucinations, starting to hear things or see things that aren't there, that other people don't experience, maybe developing false beliefs, thinking that other people are talking about you, thinking that maybe somebody's following you or going to hurt you. But there are other symptoms of psychosis that are not always recognized as psychosis. Thought disorder, having some kind of alteration in the flow of thought. Maybe things get jumbled up and confusing. It's hard to communicate. And then there can also be what are called negative or deficit symptoms, a loss of interest or pleasure, maybe not showing very much emotion, not showing motivation. So it's really all of those things together. And psychosis can characterize a lot of different situations. So, for example, somebody could be high on drugs and show psychotic symptoms.
Chemically induced.
Right, chemically induced. There can be rare medical problems that can cause psychosis, like a brain tumor, for example, could cause a psychotic symptom. But the most common forms are schizophrenia, and then sometimes mood disorders, such as bipolar, manic depression, or depression can have psychotic symptoms along with them.
Listen.
Issue in Ecuador, according to the World Health Organization Mental Health Atlas in 2014, the number of psychiatrics varies from 0.07 per 100 million people in Africa to 7.43 per 100 million people in Europe. All regions except Europe and the Western Pacific have a less than 2 beds per million people in psychiatric wards located in general hospital. And with the conclusions, psychosis is an umbrella term. It means that an individual has a sensory experience of things that don't exist or beliefs with no basis in reality. This can be incredible, frightening for the individual, and sometimes the symptoms can cause them to lash out and hurt themselves or others. Psychosis is a classic associated with schizophrenia spectrum disorders, and although there are other symptoms, one of the defining criteria of schizophrenia is the presence of psychosis. Thank you.